watching WMBD News at 3.
COVID-19 is affecting us all, but those suffering from mental illness can be particularly vulnerable during these hard times. ERIN Richards is a licensed social worker from Chicago, and she joins us now with more about how COVID-19 is affecting our mental health. Thank you for being with us. Can you give us...
Hello, how are you doing?
Well, thank you. Can you give us a sense of what you've seen since the outbreak here in Illinois? Have there been an increase in the number of people seeking mental health help?
I think there's actually been a significant decrease because I think people are afraid right now. People are unsure of how to get services, and I think we're still going through this collective traumatic experience together. So I think we'll see that skyrocket once people are able to leave the house again, once people are feeling more comfortable. I will say there has been an increase of clients returning to services that maybe their mental health has declined during this time.
It strikes me as a dangerous combination with many offices being closed and people being fearful of going out. So how do people go about getting help now?
A lot of offices are offering video and phone services, so I would encourage people to still reach out and seek services. OSF Healthcare in Peoria is actually offering Silver Cloud, which is a free program that will teach people to manage their mental health at their own pace. So I think that's a great resource you can use for free. And then as Pritzker implemented, you can text the word TALK to 55-2020, and they will also connect you with a counselor.
So isolating at home can bring on feelings of boredom or depression for just about any of us. How do we know when that level of depression becomes a mental health issue?
I would say a lot of people are experiencing the common symptoms of depression right now. And, you know, I would want people to know they're not alone. People have reported symptoms of just dealing with COVID as sleeping more, sleeping less, eating more, eating less, and those are all on the checklist for depression. So I think it would be important to encourage people to continue to reach out to their support people, whether they're living with them, whether they are able to call them or video call them, and just try and find what you can do to improve your mood and keep yourself busy at home right now.
Some great advice, Erin. Thank you so much for being with us. You take care.
You too.
Still to come, a walkout on a National Workers' Day as Amazon employees call for better COVID-19 protection.